Hi, this is Dr. Ken Starr with the Wellness Group in Arroyo Grande, California. I wanted to take a few minutes to tell you about Sublocade, the long-acting form of Suboxone. I want to try to summarize for you what's good, what's bad, and what you need to know. First of all, this is a very long-acting subcutaneous injection. That means just right underneath the skin, once a month in the abdominal wall. This is going to take the place of daily dosing of either your strips or your tablets of Suboxone. So number one, you should be stable already on Suboxone and it should be working for you well before you consider transitioning to this. So you're tolerating it, there's no side effects, you're not having any headaches, it's working, it's a good part of your recovery program, you're not having cravings, you're not relapsing. If that's the case and you're not on a very low dose, this is a good medicine for you. If you were on 12 milligrams or less, it's probably not a good medicine for you because it's equivalent to a much higher serum level in your blood. Or if you're planning on tapering off buprenorphine products in the next few months, next few weeks, next few months, it's not a good product for you. So again, if you're on 12 milligrams or less, if you're trying to get off of it, don't do a Sublocade injection. Why? Because you get a higher level and it lasts for a very long time. Okay, what's good about this medicine? Once a month injection and you're done. You don't have to take your medicines every day. If you have trouble with compliance, diversion, you're selling them, you're challenged to kind of make your medicines last. You're one of those folks that every month there's a problem, like you got them stolen, you lost them, or whatever, or you just rather not take Suboxone and use something else, then this is a good solution for you. So we like the fact that there's less diversion. We don't have to worry about somebody using some and selling some. The higher your serum level, your blood level is higher. That's good for some patients. Some of my patients on 16 milligrams a day feel better having a higher level. And it allows for essentially higher dosing. Not necessarily better or worse, but I think that cravings and relapse are prevented in some folks a little bit more effectively with higher dosing. Okay, what are some bad things? The medicine's supposed to be once a month. Some of our folks, it's lasting maybe 3 weeks. That's one issue. Number two, injection site pain. This hurts. Remember, abdominal wall pain, this hurts. We use a topical numbing cream that has benzocaine and tetracaine in it. That makes a huge difference. I'd recommend it. The studies have looked at how this medicine, which is available in two strengths, 300 and 100. You're supposed to start with 300 the first couple months, and then you can transition people down to 100 or keep them at 300. This is equivalent to about 16 milligrams a day and more than 24 milligrams a day. So that's why I say if you're on 2, 4, 8, 6, 12, you're going to get a much higher serum level. So when they looked at 100 milligrams steady state, it was more than 12 milligrams of the sublingual product. And when they looked at 300 milligrams steady state, it was double, even 24 milligrams steady state. So these are pretty high doses. Price is an issue. Again, this is about $1,500. If insurance is covering it, like it's covering your product now, not a big deal. But if you're paying cash for like generic buprenorphine, this is way, way more expensive than that. So injection site pain, the price, and then the very long duration of action. To put that in perspective, if you're stable on this shot for say 4 or 5 months, you have a steady state and you stop it, you can have therapeutic levels that are working for another 3, 4, 5 months, and even detectable levels in your blood a year later. So again, if you're trying to taper, if you're working on tapering, not the medicine for you. I have a link to a description if you want to read more about this in our blog. I'll paste that below. Share this with someone who you feel like would benefit. Please subscribe to our channel. We can get that information out to more people. I'd love to read your comments. Post them below. Thank you.